Hello, welcome to the Macy Catheter Clinical Training course. My name is Betsy King, and I'm a registered nurse certified in hospice and palliative care and the lead clinical educator for Hospice Corporation and the Macy Catheter. Thank you so much for joining me today to learn about the Macy Catheter. Well, for those of you who are brand new to the Macy Catheter, I always like to start out by letting you know that the catheter was actually invented by a hospice nurse by the name of Brad Macy. Brad had been an after-hours nurse in the San Francisco Bay Area for over 20 years when he came upon this idea one night treating a patient in extreme distress. Brad became very efficient at taking care of symptom management crises in the home in his 20 years of practice, and he found that about 80% of the time he could take care of patients with oral and sublingual medications, and they could effectively control the patient's symptoms. The family could handle the administration of the meds, and the patients could pass peacefully in the setting of their choice. However, there's a smaller percentage of his practice, and in all of our practices, where the oral route is no longer available and sublingual meds aren't effective, our patients are having more severe symptoms and they need another route of administration. Patients experiencing terminal agitation, seizures, severe pain, or respiratory distress. When this happens, we have to look for another way to get medications into our patients. Well, let's talk a minute about why this sublingual route is not very effective for severe symptom management. Well, the first reason is there's just not a lot of drugs that are actually absorbed sublingually. And the one that we use most, morphine, only has about 9% absorption when given sublingually. So when you give a patient a 20 milligram dose of morphine sublingually, they're probably only going to get 2 milligrams or so dose. So that's really not much when a patient's having severe symptoms. Additionally, giving medication sublingually, in order for the patient to absorb that into the sublingual gland and get into the blood supply, they have to hold it in place under their tongue for 15 minutes. Now, that's a very difficult thing for an unconscious or semi-conscious patient who's reclining to do. If you've never tried to hold something under your tongue for a minute, just do a little exercise now. Take a sip of any water or beverage you might have near you, just a very, very small sip, and see if you can hold it under your tongue for 15 minutes without swallowing. A lot of studies have shown that most of the medication that we give sublingually is oftentimes swallowed if the patient's lying down. Of course, if they don't have a swallow reflex, they can also aspirate that medication. And oftentimes, another place we end up seeing our sublingual medications is on the pillow, right, as it comes out the side of their mouth. So just not very effective for severe symptom management. The thing about the Macy catheter that makes it so helpful in a home care setting is that it allows for the immediate continuation of oral medications that are already at the bedside. When the nurse arrives at the home, if they have the Macy catheter in their kit, they are simply going to insert the catheter into the patient's rectum, inflate a small retention balloon, which holds the catheter in place, and then actually give medications through the distal port of the catheter that will be on the patient's thigh. So you are going to actually use the medication that's already there in the home or in your comfort kit. Most all of the medications that we routinely give in hospice care and that are probably on your formulary can be given through the catheter. The only things you can't give this way are medications that cannot be crushed or that are sustained or extended release. So there's no lag time in symptom management. You're not waiting for the pharmacy to deliver other drugs to you, or a CAD pump, or a parenteral meds, or a specially compounded suppository. You can place the catheter. It's a quick, easy, non-sterile procedure, and use the medications right on hand and get your patient comfortable in one visit. It's very discreet. The family never has to disturb the patient or access their private areas when giving the medications. And it really empowers the caregivers to provide the goals of care, which are more often than not are to keep their loved one comfortable in home. Well, the actual FDA indication for the catheter is to provide rectal access to administer liquids and medications. Since the Macy catheter is a prescriptive device, it does require an order from a nurse practitioner or a physician to insert. It's a non-sterile placement. It does have to initially be placed by either an RN or an LPN. And once inserted, again, it just remains in place by the small retention balloon. and it can stay in place for up to 28 days. The reason for that is because the balloon is very soft, very pliable. It doesn't put any pressure on the mucosa of the rectum, so there's no necrosis or no issues there. It also doesn't innervate the pudendal nerve, so the patient doesn't have a feeling that they need to bear down or defecate. It's really very comfortable for the patient, and they're just not aware of it after you've placed it. So although you can leave it in for 28 days, it's also been designed to be expelled if the patient has a bowel movement. So if the patient does defecate, it's just going to push the catheter out with the stool. If that happens, you just simply wipe the catheter off from clean to dirty, deflate the balloon, and then reinsert the same catheter. Again, it's a non-sterile catheter, a non-sterile procedure. Placement can actually be done, replacement, by a trained caregiver or family member, if this is something that your facility allows and that your family members would be comfortable doing. Reinsertion is not a real regular issue with patients using the Macy catheter. Not all, but the majority of patients using the catheter will be in their last days to hours of life, and many times are no longer having regular and routine bowel movements. Well, let's take a look at the catheter. As you can see, it looks a little bit like a Foley catheter, but it's made out of silicone. There's no latex, so you don't have to worry about latex allergies. And there's just one size. It's a 14 French, and it fits all patients. The medication administration port is where you attach an oral tip syringe and inject the patient's medication. Just inside this medication port right here, there's a one-way self-closing valve. So as you advance the plunger, it forces the valve open and the liquid medicine just flows through the catheter and comes out the holes at the tip and is dispersed into the rectal wall. You can only attach an oral tip syringe to this port. The balloon inflation port works exactly like the balloon inflation port on a Foley catheter. This is where you're going to attach a Lure-Lock syringe and inflate the balloon of the catheter once you insert it. On the hub here, it says inflate with 15 mils, and that's just a helpful reminder for you as to how much to inflate the balloon with once you've inserted. This port can only be accessed with a Lure-Lock syringe. So there is a built-in safety feature there. Families cannot accidentally inject the patient's medicine into the balloon of the catheter because the syringes will not fit on each other's port. Well, down on the shaft of the catheter, you'll find some placement marker lines. Those are there to assist you in knowing how far to insert the catheter before you inflate the balloon. There are two blue triangles or arrows with a blue line right in between them. Simply insert the catheter until this blue line is right outside the patient's body, and then you're in the proper place to go ahead and inflate the balloon. It will be up above the rectal sphincter. And again, there are the 4 holes at the tip of the catheter where your medicine comes out and is dispersed into the rectal wall. Very simple, straightforward device. Placing the catheter is pretty straightforward. It's a non-sterile placement, obviously. First, don your gloves and then lubricate the catheter with the water-soluble lubricant that comes in the kit. If you're in a reinsertion situation, please be sure that you have water-soluble lubricant. That's the only kind of lubricant you can use on the catheter because it is silicone-based. Next, insert the catheter to the line in between the 2 arrows. Inflate the retention balloon with 15 milliliters of room temperature tap water. And then just as after you insert a Foley catheter, you just want to pull back gently on the catheter, making sure that the balloon is snug up against the rectal sphincter. Position the tubing between their legs, and then using the securing device that comes in the kit, attach the distal ports to the front of the thigh for easy access for the families to administer medications. Well, let's talk about the most important thing, when to use the Macy catheter. I've already mentioned several times that when patients have severe symptoms that are not well palliated with sublingual medicine, this is the time to go to the Macy catheter. Most all of our patients at the end of life are experiencing pain and are receiving some pain medicine, oftentimes opioids, and sometimes adjunctive medication as well. Maybe they're getting dexamethasone or another NSAID or perhaps an antidepressant. When these patients lose the oral route and can no longer swallow and we transition them to the sublingual route, oftentimes we just discontinue their adjunctive medication cold turkey, and this can lead in an escalation of pain and a crisis. Many times we'll try to chase this escalating pain with higher doses of opioids, more frequent opioids, rotating types of opioids, when what our patient really needs is their adjunctive medication. So these are perfect patients to use the Macy catheter in. You can place the catheter and continue them on the opioids and the adjunctive medication that was previously controlling their pain before they lost the ability to swallow. Well, agitation is one of the most difficult symptoms to treat. This is actually when Brad actually came up with this idea, he was at the home of a patient who was having severe agitation. So it's perfect to use for patients who have agitation. It's very difficult to work around to get patients who are agitated to cooperate, and it's certainly dangerous and not advisable to try to start IVs or do anything with a needle. Because the Macy catheter is a non-painful, non-sterile procedure, it's very easy to slip the catheter in and get the medication on board and get your patients comfortable quickly. Well, of course, any patient that's nauseated and vomiting, not able to keep their medications down, is a perfect candidate for the catheter. And in addition, again, you can hydrate through the catheter by giving hypotonic fluids if your patient would benefit from that. Any patients who have a primary pulmonary cardiac disease and are in severe respiratory distress, maybe fulminating pulmonary edema, these patients are great candidates and benefit very much from getting medications through the catheter. In addition to giving morphine and Ativan to open them up and slow their breathing down, you can also diurese through the catheter. Lasix is very well absorbed and effective given in solution through the catheter. And then seizures. Our patients who have glioblastomas or other cerebral masses that are requiring anticonvulsants, once they lose the oral route, we've got to find another way to keep their anticonvulsants on board so they don't start seizing, or worse, go into status as they're transitioning. So this is a great option to continue their anticonvulsant therapy as opposed to using a sublingual or suppository. Well, many of our patients, as they're transitioning, will develop copious oral secretions. And of course, when this happens, this greatly interferes with the absorption of any sublingual medications that you're giving. So these are perfect candidates to go ahead and switch over to the catheter. The medication will be absorbed much more quickly by the dry mucosa of the rectum than it will be oral secretions that are full of oral secretions. Well, patients that are getting large amounts of medication and frequent multiple meds sublingually that are just more than can be absorbed, again, another perfect time to get your patient switched over to the Macy catheter. You know, as hospice nurses, we're always thinking proactively and looking down the road and watching, trying to anticipate what our patients' needs are going to be as they transition. And as we see our patients' PPS start to drop below 30, we know they're going to develop some dysphagia. And if they have symptoms that are difficult to manage, this is the time to initiate the Macy catheter as a first response before they develop a palliation crisis and not a last resort. And, you know, there's also quite a few disease processes that dysphagia is a factor in even before they become transitional. For example, patients who've had strokes may have dysphagia. Patients with dementia who oftentimes just will not cooperate with swallowing. The catheter is a great option for them. Patients with different kinds of head and neck cancer that can't take medication orally, or perhaps patients with ALS where swallowing is a difficulty. All of these patients are great candidates for the Macy catheter. Next, I'd like to show you a video of a nurse in a home care setting who's explaining the Macy catheter to the family and to the patient. This is available on our website and is very helpful tool for you to use when you're initiating and introducing the Macy catheter initially into your patient's plan of care. It's very helpful for families because they can see the catheter, understand how small it is, how comfortable it is, and how easy it is to give the medications through the catheter. So this is the patient care video.
Hello, my name is Lisa, and I'm a registered nurse. Today, I would like to talk about a new option for assuring you or someone you are caring for can receive medications when swallowing becomes difficult. Brad Macy, a hospice nurse with over 25 years' experience, created the Macy Catheter to ensure patients could continue to take their medications when they were unable to take them by mouth. Brad found that when his patients could not take their medication, they often had problems with pain, nausea, and other symptoms that were difficult to control. He also found that alternatives to oral medications, such as IVs, could often take hours to arrive at the home, leaving his patients suffering and without symptom relief. In some cases, because IVs can be difficult to manage at home, patients are often admitted to a facility so their symptoms can be treated. A very effective way to help patients remain at home is to give medications rectally. Until now, the rectal route has been associated with a lack of privacy and discomfort from repeated insertion of suppositories. The Macy catheter, a new option for giving medications rectally, was designed with these concerns in mind. The small, soft Macy catheter allows the patient to receive medications when they cannot take them by mouth. Quickly and easily placed by your nurse, the Macy catheter is held in place with a very small balloon inflated after insertion. The medication port is secured to the thigh or abdomen. The catheter is completely comfortable, and it can stay in place for ongoing delivery of medication. The caregiver does not have to move or bother a sleeping patient when giving medicine. The catheter will not prevent the patient from having a bowel movement. In fact, the catheter is designed to be comfortably expelled with a bowel movement. If the catheter comes out, it can easily be reinserted by your nurse or person trained to perform this simple procedure. After your nurse privately inserts the catheter, it is secured to the patient's leg or abdomen for easy and discreet medication administration. After placing the catheter, your nurse will then teach the patient or caregiver how to give medication. The medicine port simply rests on the leg or abdomen without having to expose a patient's private areas, maintaining dignity and privacy. The best thing about the Macy catheter is that your nurse can place it immediately and give the medication needed to control symptoms quickly without having to resort to delayed or uncomfortable alternatives. The catheter allows you to continue administering important medications if they cannot be taken by mouth. I hope this video helped you understand the Macy catheter and how it can improve comfort and quality of life for you or someone you're caring for.
So that video is available on our website, and we can also provide it to you in an MP4 format if this is something you would like to upload to your learning management systems or your nurse's tablets. Let's take a look at the anatomy and physiology of the rectal vault and talk about why this method of medication delivery is so effective. As you can see in the diagram here, once the catheter is inserted, the balloon is inflated above the rectal sphincter here, and this is holding the catheter in place. We all know that the mucosa of the rectum is highly vascular, and it also has a lot of absorptive cells. However, at the end of life, it's oftentimes very dry. And there's a couple reasons for this. Our patients are pretty dry. They have not been drinking or eating. They've lost the ability to swallow. So they're dehydrated, number one. And number two, we're oftentimes giving them medication that has an anticholinergic effect. So giving tablets or even suppositories into a rectum that is dry and dehydrated, it can take a very long time for those medications to get on board. And the reason for this is you have to have 10 to 15 milliliters of fluid in the rectal vault in order to break down that tablet or suppository into a form that can be absorbed. And many times that fluidity is just not there. Conversely, if you give the medication in a microenema form already suspended in water, that medication is very highly and quickly absorbed into that dry mucosa and enters the circulation immediately. So you're going to see very rapid onset of action. And I hear all the time from nurses how surprised they are and how quickly the medication works. Oftentimes, you'll see onset of action within 10 to 15 minutes, depending on the patient and the medication that you're giving. Well, another great thing about the catheter is how versatile a route of delivery it actually is. Looking at this chart here, if you look down the left-hand column, you'll see broad classifications of all the many types of medications we use to treat patients' symptoms in hospice care and end of life. Across the top, these are the routes of delivery available to us once our patients lose the oral route. We've already mentioned that the sublingual route is very limited. There's not many drugs you can actually give this way. Of course, the IV route is very, very fast and effective, and most meds can be given this way. However, it's a very expensive way to give medications. It's a very difficult way to give medicines in a home care setting. And it's very hard for families to maintain, especially if your patient is having numerous symptoms and needing more than one line. In the sub-Q method, a few less drugs can be given this way. One other comment about the subcutaneous method of medication delivery in patients who are actively transitioning. As our patients begin the process of transitioning, their blood pressure is going to drop, right? And they start shunting circulation to the vital internal organs. And that's why their extremities get cold and they get mottled. So if you're delivering medication into the subcutaneous tissue of a patient who does not have good perfusion to the skin and to the sub-Q tissue, you're not going to have very effective uptake of that medication. So it's not extremely effective when patients are transitioning. The rectal route, however, is very versatile and has still excellent absorption as patients are transitioning. And as you'll see here, there are medications in every single category that you can give through the catheter. So no matter how complex your patient is, how many symptoms they're having, if you're treating pain and nausea and seizures, you can give all of those medications through this one route of administration. So it's very versatile. Again, the only things you can't give this way are medications that cannot be crushed or that are sustained or extended release. Well, let's talk just for a minute about proctoclysis, and that is just simply the infusion of hypotonic fluid into the descending colon to hydrate patients. It is a very comfortable procedure, and it's just an alternative to IV hydration to those patients who may need it. You can actually infuse up to 250 milliliters in 1 hour. And using hypotonic fluids, most widely recommended would be water or Pedialyte. The procedure would be, you would position the patient on the left line side and then inject the medication either through continuous drip in a kangaroo bag, as you see here, or you can use syringes to inject the medication directly into the medication port. The patient needs to remain on their left side for about 30 minutes after infusion in order for the medication to be, for the fluid to be absorbed. But it's a very quick, easy way in order to give fluids to patients as opposed to IV hydration. Just like IV hydration, though, it does require an order from a physician or a nurse practitioner as to the amount of fluid you will be infusing, the type, the frequency, and the duration of hydration. Well, let's take a look at the bedside care kit. The Macy catheter comes in this kit along with everything that you need to insert the catheter and to administer medications to the patient. When you first open it, you'll see two instruction manuals. The small one is for the clinicians, goes over everything we're discussing here today. And the bigger one is a caregiver manual we have created for you to leave behind for the families. It's written in layman's terms, and it provides a step-by-step reminder of what you're going to teach them, which is how to use the Liquipill. and how to administer the medication. If language is any type of a barrier, there's a pictorial illustration of each step and they can follow along that way. We've also created some medication sheets to hopefully simplify medication administration in the home care setting for caregivers. If your agency doesn't have home care medication sheets, take a look at these and see if they may help your families. One side is for routine medicine and the other is for PRNs. Well, in the middle of the slide here, you will see the device that is called the Liquipill. I think you'll see it's been designed with ease of use for the non-clinician and the caregiver in mind. Under the Liquipill, you'll see 2 oral tip syringes. The 10 milliliter syringe is to suspend the medicine in, and the smaller 3 cc syringe is what you actually flush the catheter with after each medication administration. Over on the right-hand side of the slide, you see the catheter and all the supplies you need to insert and secure it. Well, prior to inserting the catheter, you do need to do a digital assessment of the rectal vault, obviously looking for stool. It's best if the rectal vault's empty, but it's not essential. If your patient has some amount of formed stool in their rectal vault, and in your opinion, at this point in their journey, it's not appropriate to try to remove it, it's still fine. You can still use the Macy catheter. You can still place the catheter. The liquid medication will be absorbed more readily into the mucosa of the rectum than it will be into that formed stool. So formed stool is not a contraindication. However, if your patient is totally impacted, you are going to have to deal with that and at least remove some amount in the distal part of the rectum so you can insert the catheter. Things that are contraindications for using the catheter would be any pathology in the rectal vault. So if your patient has any lesions, tumors, or active rectal bleeding, you cannot use the catheter. If the patient's had any bowel surgery in the past 6 weeks, that would also be a contraindication to using the catheter. Well, I've mentioned several times that the catheter has been designed to be expelled with a bowel movement. So if you have a patient who's experiencing diarrhea, do not use the catheter. It will continually be expelled with the diarrhea and the medication will not be absorbed. If you have a patient who has a colostomy, you can still use the Macy catheter as long as they have an intact and relatively healthy rectum. The catheter is only approved for rectal administration. You do not ever put it in an ostomy. All of the medication that you inject is going to be absorbed in the distal third of the rectum, of the rectal vault, so it doesn't get anywhere close to the colon junction. So fine to use with patients who've had a colostomy. I'm going to show you a video now where Morgan is going to explain the process of inserting the catheter and injecting medications, liquid medications into the catheter.
Inserting the catheter is much like inserting a urinary catheter, only easier, faster, and is a non-sterile technique. Insertion usually takes 3 minutes or less. First, lubricate the distal end of the catheter to the first arrow. Second, positioning the patient on the side or in supine position with knees bent, insert the catheter to the line between the 2 arrows. Third, remove the red safety cap and inflate the balloon to 15 ml using 15 ml of room temperature or cool tap water. Fourth, tug gently to assure the catheter is snug against the inner portion of the rectal sphincter. Finally, secure the catheter by running it between the patient's legs and securing to the thigh or lower abdomen. Administering medications through the Macy catheter is a simple 3-step procedure: draw, inject, and quick flush. If medications are already in liquid form, they can simply be drawn up using the 10 ml enteral syringe provided in the kit and administered via the medication administration port. Medication should be administered over 3 to 5 seconds. 1, 2, 3, 4, 5. Some kits contain another Hospi product, the Liquipill system, to help prepare medication suspensions. Once medications have been administered, please follow with a 3 ml quick flush of tap water. This quick flush should be administered in less than 1 second. 1. If the catheter is not properly quick flushed, on rare occasion there may be leakage from the medication administration port. To solve this, please inject another 3 mL using the 3 mL enteral syringe of tap water and inject over less than 1 second. 1. This should correct the situation. That's all there is to Macy catheter insertion and medication administration. For more information, please visit macycatheter.com. Thank you so much for your time.
Well, Morgan mentioned that some kits, and the one that you all will be using, contains the Liquipill. Let's take a look at the components, and then we'll go over how to use it to grind and liquefy medication. You first have a grinder, a medication receptacle, and you're going to screw a grinder lid onto that. There's holes in the top of this lid where you insert the pills and then grind the medication back and forth like a pepper mill. And the tablets will get ground into a fine powder and just drop down into this receptacle. And this is how the families are going to be able to grind the medication into a fine powder. Over here, you have a water receptacle. Simply fill it with room temperature tap water and screw on one of these syringe adapter caps. These caps have been created to make it easy for the caregivers to use syringes and to draw up solution. Next, I'm going to show a video of Morgan explaining how to use the Liquipill to grind up and liquefy medications.
Taking the tablet that you would like to crush, you simply put it in one of the 2 slotted openings. Second, simply move the grinder back and forth like a pepper mill to crush the medication into a fine powder. The grinder is very easy to move back and forth and was designed with caregivers of all ages in mind. You will know the medication is completely ground because the grinder gets smooth and quiet. And as you can see here, the medication has been ground into a really fine powder. So now you're ready to add a little bit of water. Taking your 10 mL enteral syringe, you'll put it on top of the syringe adapter cap. I just put in room temperature tap water into this water receptacle. I'm going to pull back 10 mL of the tap water and simply put it on top of the medication reservoir and inject. Next, I'll just swish and swirl for about 10 seconds. This makes sure that the medication is fully in suspension form as you get ready to give it via the Macy catheter. So next, you'll draw up the 10 mL suspension, and you're ready to administer via the Macy catheter. It is important to note that you will want to have a 3 mL quick flush to follow that to make sure that all the medication gets through the Macy catheter.
So that's all there is to using the Liquipill to grinding and administering medications through the catheter. Well, let's talk just for a minute about taking care of a patient who has a catheter in place. There's really nothing special that you need to do, just routine peri-care around the Macy catheter. Have your aides just use soap and water or wet wipes as they're bathing. And please let them know not to put any solvents or soap on the port, the medication port. You don't need to do anything to that. It is going to be flushed with water after each medication administration. As far as troubleshooting, there's not much that can go wrong. If you would ever have a patient's family call and say they've just given a dose and they see some leakage from the medication administration port, that would just indicate that the valve did not close properly. In this situation, all they need to do is repeat the quick flush. Using 3 milliliter syringe, fill it with water, inject it over less than 1 second. That'll be all that you need to clean all the residue off of the valve and make sure it closes completely. The only other thing you may run into from time to time would be leakage from the rectum. If this should happen, you want to first check for proper balloon positioning with the placement marker lines. Pull back gently on the catheter. You should be able to see this most distal arrow outside of the patient's body when the catheter is in the proper place. If it's still leaking, you want to make sure that the balloon is properly inflated with 15 mils by obviously removing the water from the balloon and adding 15 mils back in. In ending, I do want to let you know that we have 24-hour phone support. So if you need us anytime, please take out your phone and enter this 800 number right now as Macy Catheter Support. This number is answered 24/7 by one of the hospice nurses on staff, and we are here to help you any way we can. We get calls every day, and there's no stupid question. So please call us if you just need a little elbow support your first time, or any question that you might have. We're happy to help you. Last but not least, I'm going to share a video with you that is a hospice nurse who'd been a hospice nurse for about 16 years, taking care of patients, and had the sad responsibility of caring for her brother as he was passing. And she tells her story as a nurse and as a sister. And I wanted to share that with you now.
So when I'm talking to you now, I'm talking to you from two different completely perspectives. First, I'm talking to you as a nurse and having experienced what I've just gone through. And secondly, I'm talking to you as a family member who was given the final authority to make all medical decisions on behalf of my brother who was dying with cancer. His pain management was very tricky. He was on very high doses of medication such as methadone, oxycodone, lorazepam, and these things to keep him comfortable. So the first initial thing was to give him oral meds. So we started in on giving him liquid methadone, liquid oxycodone, and liquid lorazepam. And as the time progressed throughout the day, we kept dosing him up, and we were giving it to him sublingually. We were giving such large doses of liquids that I wasn't feeling so comfortable with it. I decided to pick up my stethoscope as the nursing side of me, and I put it to his chest. And when I listened and heard what was going on in the chest, I just nearly dropped to the ground, because the first thought that came to me now on the clinical side of it is, oh my gosh, we're dosing him with such large amounts of liquid medication that he's aspirating it. He's taking it down his lungs. And the last thing I wanted with my brother was to see him die of aspiration. I wanted him to be comfortable. I didn't want him choking on all the medication we were giving him. That caused a tremendous amount of grief. And my nurse, my fellow nurse, who was not there at the time because of the COVID crisis, had left the Macy Catheter in the home already. We turned him, I inserted the catheter, and I was able to give the medications via the catheter and lay him back on his back and get him comfortable. And when I saw the difference in how that medication was going in and the difference in him physiologically, he finally just began to just be even more calmer. The first thing I thought to myself is, why did I wait so long? Which told me, gee, my goodness, probably should have done this way, way sooner, and would have wrestled a lot less with what caused me a lot of guilt thereafter. And the guilt was, with my loved one, those lungs were filling up, and I would question my clinical experience after 16 years of hospice. Why haven't I used this catheter sooner? Which then brings me to the next question. How many of those patients have truly aspirated over the years? How much aspiration could possibly have occurred over all these years of not using this catheter? And that has me concerned, because as we've all heard, aspiration, getting that fluid into your lungs and dying that way, is definitely not a good way to go.
We have several educational resources that I want to share with you very quickly before we finish. If you need any more information on the Macy Catheter, the place to go is our website, macycatheter.com. If you go to the clinical corner, there you will find a plethora of information. All of our training videos are there, product information, research, clinician testimonials. I really would encourage you to take a look at the clinical corner of our website when you get a chance. We also have a thought leader webinar series where we present leading clinicians in hospice and palliative care from around the country and offer free continuing education credits to nurses about once a month. So keep on the lookout for those. We'll be sending you invitations. All the ones we've previously offered are available on our website, and you can find those under the Clinical Corner as well, under webinars. Please feel free to take a look at those and watch any of those at your leisure. Recently, we've created a Facebook page for those of you who are active on Facebook, and this is a clinician-only site. We hope you'll join us and join the conversation there. Thank you again for joining me. We look forward to partnering with you on your mission to provide excellent end-of-life care. Thank you so much.